my name is Lisa Rose, I'm on the Community University of North Ceredigion. This is just a short video to discuss cord care of a new baby until their cord drops off and how to put a baby's nappy on, because it's basic skills like this that you'll be doing a lot, but sometimes can be quite fumbly. So this is baby George. As you can see, he actually doesn't have a cord attached to him. He's probably about 4 months old, so he doesn't have a cord attached to him. But the main principles are, most babies are born, and I'll just show you on my little baby Thomas over here, with a cord attached to their stomach, which then attached to the placenta. After birth, we will clamp and cut the cord using a cord clamp, which generally goes about here. So this part of the cord and the placenta is taken away, and the baby will be left with a small short amount of cord and a cord clamp. Place them down. That bit of cord and that cord clamp will normally just dry up and drop off within about 10 days of birth. But on some babies it can take a little bit longer, and some babies it can drop off a bit sooner. The way that the process of it drying up and dropping off is basically gangrene. So the cord can quite often become a little bit sticky and sometimes have a smell to it. So the reason why we discuss cord care is to make sure that moms are aware of things to look out for, and if they're worried about anything, to contact their midwife. So the best thing that you can do is keep the cord as clean and dry as possible, and one of the ways that you can make sure that that happens is that when you pop the baby's nappy on, you ensure that the front of the nappy is folded down under the cord, and the cord and the clamp are kept out over the nappy, because when babies pass urine a lot, sometimes that can, if the cord is sitting inside, that can keep the cord quite damp and stops it from being able to dry up and drop off effectively, and increase the chance of there being a smell or a bit of discharge around. So keep the cord outside of the nappy. Keep it nice and clean. If you notice that the cord gets a little bit sticky around, then don't be afraid to clean it. People are quite often afraid to touch the cords. It doesn't hurt the babies if you move them. Even when they've dried up, it doesn't hurt them if you move them around, to make sure that you clean around it. And the best way to do that is warm water in a bowl, cotton wool, and you just basically wet the cotton wool, squeeze it out a bit, and you just clean around the cord, moving the cord out the way to get underneath it. If you do that, any smell or any stickiness should disappear, and you may need to do it a couple of times a day to make sure that there's no continued smell or stickiness. But if the cord is nice and dry, has no smell, no stickiness, then leave it alone and keep it out of a nappy, and most of them will just drop off on their own. They sometimes leave a small little scab on the inside, which will then just dry up and drop off at a slightly later date. So don't be afraid of the cord, but the principles are trying to keep it clean and trying to keep it dry. How to put on a nappy. So most nappies come looking like this, generally a lot smaller. And they will come in clothes like this. Most nappies, even the newborn nappies, and I think I have a newborn nappy here to show you, will have something on the front of them to differentiate the difference between the front and the back. And like on the Aldi nappies, that's a little lion's front face, back face. On the Pampers, it just says something on the front but nothing on the back. So most nappies will have a difference so that you know which way round the nappy should go on. Also, when you open up a nappy, the back of the nappy will have the tabs which stick together onto the front, and the front of the nappy just have no sticky tabs. So you open out a nappy and make sure the tabs are pulled open as well. You would lift up a baby's legs and place the nappy underneath, and the bottom in the middle of the nappy. Then most babies will be kicking around at this point, so sometimes you have to hold their legs a little bit. You bring up the front of the nappy around, keep it quite tight to the baby's belly, obviously not too tight, you should be able to put a finger in there, but quite tight because you don't want urine or other things leaking out the top or side of the nappies. You bring one tab round to the front and then the other tab round to the front. Don't be afraid of it looking a bit tight. As long as you can get a finger through it, then you're fine. I've been to a lot of parents where the nappies are on really loosely because they're terrified, but then they don't really hold much in. So you want a nice, good, well supported nappy. And then obviously, aside from the fact that George is 4 months old, you can then just fold down the front of the nappy like that and keep the cord out on top. And that is how we advise on cord care and how to put a nappy on.